Welcome to South Carolina, where we are known for our smiling faces, beautiful places, and the 2017 NCAA Division I champions. You may be asking, what does this have to do with MIECHV? Well, it tells a story of how our state is in the season of celebrating successes in many different sectors. On March 15, 2016, we celebrated a national success. South Carolina MIECHV Program Manager Eric Bellamy was invited to testify before the Ways and Means Committee. Here's what Eric had to say.
In 2010, Governor Sanford designated Children's Trust as the lead agency to implement and administer the state's MIECHV grant. Like other states, we conducted a needs assessment to determine which communities were most at risk and which proven interventions would best be suited to meet their needs. Our needs assessment identified counties with significant populations of families at risk for poverty, poor birth outcomes, child abuse and neglect, and low school readiness. Even in a state the size of South Carolina, no one approach meets the needs of all children and families. We selected 4 evidence-based models to meet the needs of children and parents: Healthy Steps, Family Checkup, Healthy Families America, and Nurse-Family Partnership. We have since added parents as teachers, and in 2013, we expanded from 12 counties to 38 counties. To date, over 6,200 South Carolina families have received MIECHV home visits.
As we assisted in gaining the spotlight for home visitation, we realized the time for improving advocacy efforts in our state was now. However, we needed a simple tool that explained the intricate initiative of home visiting. With the assistance of Next Day Animations, we were able to create our first whiteboard video. In addition, over the past year, we have continued hosting our staple events that support the work of our LIAs and provide over 35 knowledge and skill-building opportunities. These events include the Home Visiting Summit, Performance Measure Workshop, Home Visiting Retreat, and Financial Grant Training. Take a look.
Let's talk about home visiting and why it's an investment that just makes sense. We know that the early years of a child's development are the most critical to achieving school readiness and eventually succeeding in life. Parents are a child's first teachers, but many families face significant barriers to thriving, such as poverty or developmental delays. What if there was a way to meet these families where they are, to provide one-on-one guidance and support? Well, it exists, and it's called home visiting. Home visiting is a voluntary relationship between a family and a specialist, such as a nurse or social worker, who meets with the family where they live to provide developmental activities, health screenings, community resources, along with parenting information. It's not a one-time visit. This is about a long-term, ongoing relationship that provides a stable source of advice and support proven to reduce the risk of child abuse and increase the odds of family well-being. Home visitors who are typically nurses, social workers, or early childhood specialists can also identify developmental delays when the chance of a successful intervention is highest. This early intervention gets a child ready to learn and succeed in school. Because when children do well in school, they do well after they graduate, which means a thriving local community. So each dollar invested in early intervention home visiting prevents dollars that would otherwise be spent in more costly interventions down the line. Home visiting just makes sense, especially when you look at the positive outcomes. Learn more about home visiting programs at schomevisiting.org.
The movement is called home visiting for a reason. And that means they're getting out into communities, into homes, working directly with children and families. I mean, what a calling.
Well, since 2010, we've been working in the world of home visitation and bringing home visitation across the state with the idea that not one program fits everybody. And our intention is to be able to create a continuum of home visiting services in every county so that the families can get the program that meets their needs, not just the one that we happen to have.
Home visiting is critical for certain subsets of the population we serve. And obviously, much of our focus on it in the past couple of years has been for early childhood and making sure that we find models that have a good evidence base and that can be operated with fidelity by practitioners who are qualified and experienced.
health is produced in where people live, work, play, and learn. So having an intervention like home visiting, where it goes actually into that just daily life experience space, is teaching us profound things about what it's going to take to really improve child well-being.
The most important thing is really seeing these families strive and become self-sufficient. We want children to grow, to be healthy. We know that these are the most important parts of a children's life. They're predictors of some very important things later on in life. It's not just Children's Trust making this happen, that our local initiatives are really working hard as well.
Successes are always met with challenges. On October 1st, 2016, MIECHV's performance measures changed and reduced in number. However, MIECHV staff and the USC evaluation team had to host several webinars to train the LIAs in data collection, as well as recode the South Carolina MIECHV data system. South Carolina faced another great challenge when HRSA announced it would no longer recognize Healthy Steps as an evidence-based model. Our home visiting program coordinator, Kathy Ramage, took lead in supporting our sites during this transition. Home visitors had to attend several trainings to prepare for implementation of the new model. MIECHV reauthorization is an imperative effort that we all hope to see success in. South Carolina recently had a small win in this challenge by having Senator Tim Scott sign on to the Senate Finance Committee reauthorization letter on August 10, 2017. South Carolina also participated in the MIECHV Day of Action tweet storm, which Children's Trust reported that South Carolina had 8% of the reach for the national hashtag. Also, we took another step towards reauthorization by having our mothers in our program voluntarily complete our Moms for MIECHV postcard, which will be delivered to DC during the All Grantees meeting. In March of 2017, our home visiting resource coordinator, Amber Schrenkel, saw the challenge of streamlining our communication to LIAs and created our administrative broadcast entitled The Front Porch. This broadcast reduced the number of sent emails and phone calls between the state leads and LIAs by having one source that housed all important communication. A house theme existing amongst the sections of the front porch include foyer facts, library learning, parlor press, consortium kitchen, down in the den, resource pantry, and back porch beats. Upcoming trainings are announced, links to old webinars, national, state, and model news is shared, and new staffers and partners are introduced. Beyond celebrating successes and working through challenges, South Carolina MIECHV frequently assesses the opportunity for growth through evaluations, CQI, soliciting feedback from HRSA, and collaborating with state lead partners. Through publications of South Carolina MIECHV evaluation team at the South Carolina Rural Health Research Center, we are able to share the outcomes of our work reflected from August 2015 through September 2016. South Carolina MIECHV has a comprehensive evaluation that examines 5 areas: benchmark measures, outcomes comparison, network analysis, interviews or focus groups, and workforce assessment. Outcomes can be reviewed by retrieving a copy of our home visiting brochure or our Year 5 infographic. MIECHV's second learning collaborative was led by our home visiting QI coordinator, Iceland Baldwin, in South Carolina with the consultation of a 12-member expert faculty, including QI expert Pam Gillum. The learning collaborative aimed to make improvements in family engagement and developmental screening and surveillance. South Carolina home visitors achieved the goal of keeping 85% of the scheduled home visits according to the program model and has opportunity for growth with developmental screening. Data for 27 measures were captured over 16 LIAs. 2 of the LIAs also participated in the home visiting coin. On June 13th through the 15th, South Carolina had its first federal site visit conducted by HRSA. It was an exciting time to reflect on accomplishments and potential future gains. One accomplishment highlighted at the federal site visit was the reconvening of our South Carolina Home Visiting Consortium. The mission of the consortium is to coordinate, promote, and advocate for home visiting efforts that support the children and families in South Carolina. In January of 2017, the consortium established its strategic plan and charter. The consortium's first retreat was then held in August 2017. With a vision to have healthy families and thriving children in South Carolina, there is much more work to be done. Through the launch of our home visiting website, we hope to better serve the families of South Carolina through strengthening collaboration, evaluation, advocacy, and the workforce. To learn more about home visiting in South Carolina, please visit www.schomevisiting.org.
I realize my time is up, though there's much more that I could say. If you remember only one thing from South Carolina, I hope it is this: MIECHV is evidence-based policy that works to empower families, coordinate services, and unify systems. I appreciate your time and attention this morning and will be happy to answer any questions you may have.